just your thoughts about how we could integrate our efforts for greater impacts. Anybody get to that question at all? Any thoughts about that? Yes, make them all learn how to swim before you graduate from high school. You need physical fitness in high school. And resources, any educators in the room? Okay, great. How about someone else? Yes.
How much it costs when we don't do this? When people, number one, people go to the emergency room instead of having a doctor, that's 10 times. But also, when they're not healthy growing up, don't eat the right foods, don't get exercise, and then they're in poor health as they get to their 20s, their 30s, and their life expectancy is less. And the healthcare costs are tremendous. It would be better if they were all healthier, not to mention that they didn't better.
Totally agree. Any other suggestion about how we can integrate our efforts? Yes, Michelle.
There's a lot of integration of efforts going on in Detroit, but there are some obstacles that need to be settled in order for the efforts to be integrated and our collaborations to succeed. And the issues that the presentation brought up for us was there are three things that prevent the collaboration: power, money, and policy. And if the policies promoted community input and development and healthier environment, that would go a long way toward the integrating of the efforts.
One more, and then we'll get to interact with Dr.
Probably the greatest thing that causes not to be great economic disparity. Economic disparity, and then as Dr. Jackson was saying, what's the cause? Let's look at what is the cause of economic disparity we experience now.
Thank you. So, Dr. Jackson, I want to start this off. We had a brief conversation about what love has to do with it. And given this is MLK Day, I'm curious, just real concrete examples of place where love is working with addressing some of these issues from your perspective. And if not, what would you suggest? And then we can.
So the poorest city in California is Richmond, California. It's where the Chevron refinery is, or San Francisco. And I was on a work group thinking about the redesign of Richmond. And the good news is there is a fair amount of money because Richmond has to, Chevron has to pay taxes. It's only 110,000, 120,000 people, but it's very, very poor. The California Endowment has only named 13 cities that they would make the poster children for fixing that. They're doing multi-pronged efforts. One that I was very fond of was where they were hiring young people who were aging out of gangs. It sounds odd, but they were a little too old to be in gangs, but they knew leadership and they were good at it. And convinced them to begin a leadership group for the planting of trees in Richmond. Now, it sounds kind of corny, but they would have to go around a neighborhood they knew well, knock on the door, say, we'd like to work with you to plant the tree, but if we plant the tree, you're going to need to water it and take care of it. And we need to have a block party as we put in the trees, and we need to have people pitch in. It happened. And there wasn't a big academic investigation about whether trees are good for people's health and reduce pollution. Everybody knows that trees are good for you. There's so much stuff that's obvious that we end up thinking we've got to study. My favorite is, are people healthier and happier if they're near a window? Where do the rich people and powerful people in a company want to work? At the window, right? They want to get a corner office. And so everybody knows trees are good. There are stupid trees that pick up the, you have to pick smart trees. But, so this is like, it was really about love. It was about knitting the neighborhood together with the tree planting effort. So, just to close that story quickly, after Ferguson, we had marches in Berkeley, of course, and people blocked Highway 80 and broke a lot of windows. In Richmond, there was a demonstration that was led by the chief of police in Senate. And he was out there, and the police were marching with the demonstrators rather than opposing the demonstrators, saying this is what we need to do. And the police were this is really important. The police came to the meetings on the redesign of Richmond. And not just the planning commissioners and the health people, but chief of police or a very senior person. And my experience is that a good police officer sounds just like a public health person, because they want kids to be at home and be with family and be properly socialized. I'm not saying all cops are that way, but a lot of them are really good public servants. So that was really bringing love. The last one is a little corny, but there are going to be tools on the horizon very, very quickly for community engagement, for walkability, and it's called PECI, Pedestrian Environmental Quality Index, where they actually can track your walking. And there's a group called Map Tracker that will track both, look at maptracker.com, or they're tracking where people walk and where people bike. One of the things that's interesting is when they did map tracking in Minneapolis, for example, guess where people walk and bike most? You can see the outlines of every single water body. People want to be near water. And you've got plenty of water, and parks and green space are nice, but really, and people will turn out when there's a water feature. And so, and by the way, if you exercise, it raises your serotonin levels, and reduces your stress hormone levels. If you exercise in green space, it's even more.
Do we have a question from the audience for Dr. Jackson?
There are, in Canada, for instance, they outlawed high fructose corn syrups. And I wonder how close we are to that here. And also the hydrogenated oils that they use and everything now.
I believe trans fats are pretty much out of the American diet. New York banned them, and I think they're in the process of getting trans fats out, which are kind of the worst of the hydrogenated oils. I live in Berkeley, and we just passed a 75% majority a tax, relatively small tax on sugar-sweetened beverages. We were outspent by the beverage industry 50-1. San Francisco almost passed it, but they needed a 66.6% vote, and they fell like 1% short. We have got to have a sugar-sweetened beverage tax. No one needs to be drinking a big gulp. Nobody needs to be drinking anything more than, if you want an occasional 7-ounce Coke, which is how they were when we were kids. Yeah, okay, but you don't need all that. And by the way, it's a 7-ounce Coke. It would work out to a half a cent tax, so you can afford it. The tax needs to be used for kids. Our kids are bearing the brunt of this epidemic, and the behaviors that we program in our young people will stay with them for a very long time. Americans don't like taxes unless they can show think outlawing is tough to do in the U.S. for a lot of reasons. Taxes are hard enough, but at least that way. Cigarette smoking will never be gone. We're down to about 14% in California, but it's a whole lot better than it was. It is saved, we're not joking, it's $82 billion in tax on cigarettes over the last 15 years that we've had. It's saved $82 billion in healthcare costs by doing the tobacco efforts. I think the same is going to happen with sugar, probably not as extreme, but with sugar as well. So.
Effect of some foods on the teenage brain and other kinds of activities.
So, rates of hyperactivity have doubled in the U.S. Over the last generation. There are schools in North Carolina where 20 to 30% of the boys in third grade are on stimulants and medicines for hyperactivity. I think in some ways there are lots of reasons for this, chemicals and TVs and video screens, but I think that engineering physical activity out of children's lives is a colossally stupid thing that we've done. I skipped the slide where 60% of kids walk to bike to school as kids, but now it's down to about 13%. Kids that walk to school behave better, socialize better, and learn better, and they're more enjoyable for their parents and the teachers if they do this. They like themselves better if they're physically active. So I think in some ways teaching to the core and teaching to the test and not teaching for real education has been a disaster for our kids. The other thing I've learned as a parent of 20-somethings is their brains, these males' brains aren't really formed until they're about 27 or 28. We won't go there.
I have a question. The economic engine that you talked about the auto industry, has had the unfortunate consequence of setting our city back tremendously in regards to public transit. We have economic powers that have resisted this for many, many, many years. We have a region that has resisted it for a variety of causes. Could you talk from a health point of view about the impact of having public transit as opposed to a car-driven region?
One is you're blessed with a lot of space, but you're also a person with so people are so spread out that they can still function. The benefits of public transit are people who use transit. This happened in North Carolina, Charlotte, North Carolina, the light rail system in place. They went back and there was the average light rail user after 2 years weighed about 6.5 pounds less than the person who was going back to work. 6 pounds across all of America would be a huge benefit. Number two, they were 80% likely to meet the Surgeon General's guidelines for physical activity simply by walking with the transit. And it would be fun to begin to calculate what dollar benefits are of those health costs. Three is your carbon footprint when you're in light rail is, I've seen those as high as 20 times cheaper. Once steel on steel is moving, rail is moving, you don't need a lot of energy to move. The carbon footprint is much higher. But stop and go to it. I don't get into the future of cars. It's very hard. We've built America for cars. The real truth is, it reflects a little bit of that slide about our young people don't want to live in car-dependent communities. They really want to be in real communities. Quick story. I visited Oklahoma. The president of the University of Oklahoma was David Bowen, who was governor, mayor of Oklahoma City, and senator. He was chairman of the Senate Intelligence Committee. He got up and gave a speech to 800 of his best friends. Invited 800 people. He showed us Oklahoma's going to die because all of our bright young people, and we graduate, a lot of bright young people move away because they don't want to live here. And until we begin to figure out how to create cities that our young people want to stay, you're going to continue to lose your children and your grandchildren. And in some ways, the Chamber of Commerce and the other people sitting there heard that better from that esteemed leader than they would hear it from some outsider. And it really resonated with their hearts. It was impressive. Look at the University of Oklahoma website on healthier livable communities. It's really quite powerful. So I don't have a great answer for this. So it's evolution.
Great, enjoyed your presentation so much again. About 3 or 4 years ago, we had Reverend Willie Kyles come for MLK Day, and I asked him, we sort of took him around and shared with him what we were doing. He was a gentleman that was on the balcony with Dr. King when he was shot, and he was actually the house that Dr. King was due to go to for dinner. It was Reverend Willie Kyles. So I said, what would you say as you, observed a lot of what we're doing? And he said, or what would Reverend Dr. Martin Luther King say? He said, he would say that he's pleased but not satisfied. And as I listen and hear from people, I think we're in a great place of dissatisfaction. We're pleased with the wonderful work that you and others have done nationally in terms of showing, the data that can help drive decisions, but we're obviously not satisfied because we're here today. So my question to you would be, how then with this very diverse, amazingly talented body of people that are obviously engaged to show up at an event with a week's notice, of course to hear you, Dr. Jackson, but also because they're highly motivated and engaged at some level, what would be your thought or your recommendation in terms of how we could move forward collectively? And I hope I didn't, okay, because collective impact, what could be a next step for us? And if you need a few minutes to think about it, because it's a fairly sizable question, but I just see this gathering and I'm just really blown away. To me, this is really a pretty phenomenal group of people. And with healthcare, wanting to be more at the table, with people that are already well acquainted with the issues, highly motivated, how can we drive an agenda in a way, collectively, to really transform our communities? And our vision for Henry Ford, as Tom said, is transform the lives of communities through health and wellness, one person at a time. And that one person could be one policymaker. It could be one person in clergy. It could be one group part of the Detroit environmental agenda. But how can we move forward? And like I said, if you need a few minutes, let us know. If not, we can give you the microphone.
One of my favorite expressions in French cooking, I'm not really a chef, but you'll know this one. Mise en place. M-I-S-E-N-P-L-A-C-E. When you cook really good French food, everything's got to be ready and in place. Parsley's chopped, this is there, the egg white is whipped, etc. And then you start cooking. I think this room is mise en place. Everything is ready. Sooner or later, you gotta turn on the burners and you gotta start throwing the stuff in and making it happen. And it takes real attention. So, more practical comments. Literally 20 years ago, I was meeting with Herb Needleman and a bunch of friends who were concerned about childhood lead poisoning. And we had 20 people in the room really concerned, and the thing wasn't taking off. We didn't have the laws, we didn't have the leadership, we didn't have this, that, and the other thing. And we decided we would form the Children's Alliance for Teen and Childhood Lead Poisoning. We got $250,000 from the donor. Began to put this in place, hired a person in Washington, D.C. who was a really effective operator to make that happen. All of a sudden, we got the law. We got to be put in place nationally. We got HUD to really step up. We got CDC to change the definition of lead poisoning. We got funding going out to the states. But the other thing that Network did was actually begin to create a node that was a regular meeting every 2 months where people actually came together. There were newsletters going out, and it created an identity for the issue. Because otherwise, still, it was a diffuse set of feelings until that identity occurred. My prejudice is best choices I've ever made, Janet, was hiring a very young, energetic woman who worked on the Hill, but now had a baby and really wanted to make things happen. So that would be the second big one. I want to just say one more thing, and I should have said it at the beginning. So in my class, third, I say, I want you to describe, for the next 15 minutes at your table, describe a healthy community. At your table, you're the environment. I want you to describe an environmentally sustainable, smart community. And at your table, I want you to describe an economically vibrant community with good jobs and all the rest. We'll come back happiness there. And they all get up and start talking, and pretty quickly they discover we're all talking about the same thing. And it's just a matter of getting our language around it. Because you have a critical mass, you're at the tipping point, but it's not going to happen if you all stay in separate spots.
On the homeless, because they have medical issues, environmental issues. I don't want to, I'm pretty sure you have a long letter. What is your, I mean, because they still live in the environment, and we still have to be concerned about them.
We have tremendous homeless problems in California because, frankly, a lot of homeless people across the country are handed bus tickets to California when the weather gets bad. Westwood, which is where UCLA is, has partnered with a very deep homeless advocacy and homeless housing organization. And, you know, you all know that half the people, I'm making numbers up, but half the people that are homeless have addiction issues or substance issues. An overlapping half have mental health issues, an overlapping half have just been devastated by healthcare costs and bad luck. And the first thing a homeless person needs is not advice. It's not even food necessarily. It's not removing their addictions and dependencies. It's a place to live. And until we give people a safe, clean place to live, where they can shower, where they feel secure, where they can sleep through the night, we're not going to succeed with anything else. So, and I think it's, I talk about it in the book, but it's, I grew up in Newark. New Jersey is a tough town. You never saw homeless people everywhere. And this closing of the mental hospitals is a disaster. You know, these people were clean and well fed. And mental hospitals I saw when I was a young medical student, they weren't wonderful. They were a whole lot better than sitting in a street corner or in a doorway. And we have got to do much more about our homeless in this country. It is shameful.
Dr. Jackson, I know we only have 5 minutes left, but I was hoping that you could speak to one more topic that I think is very important. We have an incredible group here, super diverse from all different disciplines and sectors, and it was only a week of notice, so that may be a big factor in it, but we're missing in large part a critical presence from our city officials. And so I wanted you to speak to the special role that a city plays in creating a healthy environment without taking away any of our agency or responsibility as community stakeholders. But there is a special role, I believe, that the city plays. And if you could speak to just your take on that from the various cities that you've been.
So, thank you. Forgot to say one more thing, which I'm going to say first. We have a group in the Bay Area called the Public Health Law Project that actually has changed their name now to Change Lab Solutions. One word, Change Lab, and then another word, Solutions. Maris Ash started it a dozen years ago. She's the one that dreamed up a lot of the tobacco laws, the sugar tax laws, and the rest. Her last name is ASAG. They have a whole element now that's thinking about urban planning with very high-end PhD urban planners, but also 20-plus lawyers. They've got the smartest lawyers you ever want to meet. These are the graduates from the top law schools in the country who got to work and decided they didn't want to spend their time defending Bernie Madoff or whatever it was going to be, and they wanted to do meaningful law. And you walk, it almost brings tears to your eyes again because you walk in and they're so energetic. So, why did I just tell you this story? Because law is really important, and the way to get politicians and others is formulate a test bill. Try to get somebody to carry it. You're going to lose the first time. You're going to lose the second time. It'll actually be a better bill that third time you try it, but you've got to be political and you got to. Second, I love this research. The word in Latin, the Jesuits had me for a long time, the word in Latin for flock or herd is rex regis. Rex is the nominative, regis is the possessor. So the word aggregate is where the animals or the critters come these huge flocks of birds, and suddenly they turn and start moving in a different direction. And you've seen these pictures of fish swimming, these little fish swimming in these enormous, they call them fish bowls with 10,000 fish. And all of a sudden they're going this way. What makes them turn? Well, then they were doing studies about what changes the social direction in a community. And guess what? The tobacco industry figured this out in the 1920s. They had pretty attractive women walking down Fifth Avenue on Easter Sunday carrying cigarettes. So here's the number. 7%. All it takes is 7% of the population who are energetic, a bit charismatic, who want to be leaders, and the population will turn. It doesn't matter whether it's fish or wildebeest or something else. So you don't need to convince all the kids, all the electeds, or anybody else. Get 7%, because if you get a number of them on board, and my experience with politicians, by the way, I always joke that they point with pride, view with alarm, but they'll tell you, no, that's a stupid idea. No, I can't do it. No. And then they get pushed in the corner and they pass something, and then they say, I had this idea, it was my idea all along, right? They will, so I never worry about being told no by an elected official. Their job is to be in front of the parade.
Thank you so very much, Dr. Jackson. That's been awesome. This has been an awesome opportunity.
Thank you all so much for coming today. We're really excited. Some of the funnest part of this was putting together the invite list as our partners kept contributing this task force, that committee, that coalition, this initiative. There are so many of us who are working for clean, healthy, safe Detroit. And just some final wrapping things. Everything was videotaped today. We will send out the link, and please share with people that you think should have been here today to hear the message. Give it to Gia. We'll send it to all the city officials and elected officials who couldn't make it. We are also at the Detroit Environmental Agenda working on including sustainability and resiliency in our city's master plan. We're working together with the City Council Green Task Force and Detroit Future City, and we would love for any who are interested to join in that. And please look out for an email in the next couple of days with the video link, and also a few questions about how we can stay engaged in this conversation together. And I'll just pass it off to Dr. Wisdom for final remark.
Great, thanks again. I want to just acknowledge the planning team and the leadership that went into putting this meeting together, and will certainly provide tremendous guidance as we move forward. Sandra, if we can give her a round of applause. Her entire team, as well as two of our Henry Ford Health System team members, Barbara Bloom Alexander, as well as Chip Hamel, and their tremendous team. So just very, I'm just overwhelmed. I really am. I can't wait to let Nancy Schlichting know how well this went, and really get her engaged around how we can continue to move forward. So we'll look for that email, and unless there's anything else we need to address in terms of valet, parking, or any other logistics, are we good? Are people pretty squared away? Please eat. It's healthy. It's good food. So please eat. You're welcome to stay around a while and socialize. And again, safe travels home, and we look forward to engaging you in a very robust way in the future. Take care.